Good afternoon, everybody, and you're very welcome to Trinity College and particularly to the School of Nursing and Midwifery. I want to welcome everybody here. I know we have some of our alumni present, members of the general public, of the health service providers, and our own colleagues from across Trinity. Particularly want to welcome the Minister, Dr. Leo Varadkar, the Provost, Dr. Patrick Prendergast, and our Head of School, Professor Catherine Comiskey, who are joining us this evening. My name is Carol King and I'm Assistant Professor here in Children's and Young People's Nursing, and with my colleague Jenny Ryan we run the Civic Engagement Programme. And we run a series of lectures which are called the Tell Me About series, and we have 7 of these each year, and the whole idea behind them is to disseminate research information and share unique experiences with the general public and air matters of importance. I would ask you before the lecture starts, please, if you have a mobile phone, to make sure it's on mute. And just to take note of the 2 exits at the back of the lecture theatre, in case an alarm goes off, and there's one here. The Minister will speak to us now, and then we'll have a question and answer session. There will be roving microphones, so if you wish to ask a question, please raise your hand in the air, and somebody will approach you with the microphone. So I would like you to give a round of applause and a welcome, particularly to the Minister, as we're delighted that he is coming here as Minister for Health, that he's visiting the School of Nursing and Midwifery for the first time, and as a fellow health professional. And I'd like you to give him a warm round of applause to welcome the Minister.
Thanks very much for having me, and first of all, my apologies for being late. It's just got called to a debate in the Dáil this evening on everything from, I think the first one was about respite care in Dublin, the second one was a GP list that has gone unfilled in Laois, so it just gives you an idea of the kind of things that in theory you're directly responsible for, but of course in reality you may only have a peripheral knowledge of. Provost, Professor Comiskey, ladies and gentlemen, alumni and friends. First of all, it's a pleasure to be back here in Trinity to discuss some of the challenges facing our health service as part of the School of Nursing and the Midwifery, School of Nursing and Midwifery Civic Engagement Series. I was really delighted to receive the invitation, and also I want to congratulate the organisers on what I know has been a very successful series of lectures to date. I've often heard the Provost speak before about the value of a Trinity education, and in particular the opportunities to learn outside the classroom as well as inside it. That was certainly my experience as a student in Trinity, and while I enjoyed my medical studies and certainly learned a lot that has helped me in my current role, I also learned a lot from meeting students from other courses across the college, sharing experiences, making friendships and debating ideas in a range of different environments. I admit, though, that sometimes it all became a distraction from my core studies, and while I was a student, I ran for election to Fingal County Council. I managed to bomb on 2 occasions, failed my second year exams, and managed not to get elected to the council. But there's no shame in failing, I think, once you learn from it and you move forward. And I did manage to pass my supplementaries and subsequently got elected to the council the next time out. But I think, having caught the bug for politics at that stage, even as a student, politics probably became more priority for me than medicine, although in both cases I was motivated by a desire to make things better, to change the things around me for the better as much as I could. I learned an incredible amount from my time here in Trinity, and college is a time, I think, in many ways for self-development and self-reflection, and that's what makes it such an exciting and energising time. Being Minister for Health has also been very exciting and very energising, and the question that I often get asked by people is, do you like being Minister for Health? I think people love the popular perception that it's a poison chalice, that it's a place filled with landmines, and very often it is, in fact. But I think what that does forget sometimes is that 2 Ministers for Health went on to be Taoiseach, including the man who dismissed it as Angola. Another went straight on to become a President of Ireland. And indeed 2 of our leading economic ministers, Brendan Howlin and Michael Noonan, are in the Cabinet, and they are former Ministers of Health too, as indeed is the Leader of the Opposition, Micheál Martin. And I think the reason why that is the case is perhaps, even though it is an extremely tough job, they've benefited from the experience of being in what is a very difficult ministry. You get a huge amount of experience in dealing with budgets, and of course there's never enough, even in times of plenty. Making very difficult decisions. Often you have to make several decisions in the one day. That can be very difficult. I think it was reading, I think it may have been Bill Clinton's biography, perhaps it was another politician's, where he kind of pointed out that one of the most difficult things was just having to make so many decisions in any one day, often with limited knowledge, or only as much knowledge as you can possibly assemble in a short period of time, and then having to stand over that, and that can be very challenging. Certainly the number of decisions you might make in health in any one day would be 4 times what it was in my previous job, but the import and impact of those decisions is so much greater. You always have to, of course, weigh up competing options. There's always competing demands for resources, competing demands for time, and as well as that, you learn a lot about managing crises. And of course, you learn to understand what a crisis really is. My threshold for crisis is at a very different level than it was in my previous job. So look, it's a big challenge, but I think in politics and in life in general, only a coward would shirk from a challenge such as this. So I do very much enjoy the job. I think I would probably have regretted if I'd managed to go through a couple of terms in the Dáil and not having had the opportunity to do it. And indeed, it was very much the reason why I got involved in politics in the first place, because I saw the world around me and wanted to make it different, whether it was the way my community was planned or the way the health service worked or hospitals operated. So I think it was Kennedy quoting George Bernard Shaw, who said that some people see the world as it is and ask why. Others imagine the world as it might be and ask why not. And that probably sounds a little bit idealistic, and I may well yet fail miserably, but at least I tried, and I won't be as bitter for the rest of my life, at least having tried to make a difference. So I don't think there's any point in looking for easy ministries. I don't think there's any point in looking for easy jobs in whatever career you choose to pursue, because if you don't take risks and play it safe, obviously there's much less that you can achieve. Shortly after taking over as Minister for Health, I was asked by the Medical Independent to name the person that I thought was the best Minister for Health. It was an interesting challenge and forced me to look back at former holders of the role and to try and assess what they got right and what they got wrong. While it would have been easy for me to name the obvious person, and a former graduate of this university too, Noel Brown, as the best Minister for Health, I thought that might be a little bit too easy, because the story of how he fought TB and how that battle was waged and won has actually been a little bit oversimplified by time and hasn't taken account of the invention of antibiotics like streptomycin in particular. That's not to say that what he didn't do wasn't a huge achievement. So instead I spoke about somebody else who actually wasn't Minister for Health, but was another Trinity graduate, and that's a woman called Dorothy Stopford Price, and some of you may have heard of her. She studied medicine in Trinity back in the 1890s, was one of the first women to graduate from the medical school, and went on to become a medical volunteer during the War of Independence. She played a key role herself in the fight against TB, and I suggested that if she'd ever been elected to the Dáil, she would have made an excellent Minister for Health. But I think any Minister for Health would struggle under the current challenges, even she. And what we've had essentially in health is a very difficult period over the past 7 years. We've had 4 years of cuts under the last government, which took their toll, and a 3-year budget freeze under this government, which of course has made this a very trying time for those who are sick or on waiting lists. Even though we had a small increase in the health budget this year of about 150 million, the demands are increasing with our ageing and growing population, and even with that, we're spending about 1.5 billion less than we did 7 years ago, and have about 12,000 fewer staff. And there wouldn't be many countries that can say that. Sometimes I wonder why things aren't actually much worse, given that we've had 7 years of rising demand and yet fewer staff and less money. But I think the reason why that is because the health service actually has become much more efficient. It's seen as inefficient, and it does have inefficiencies in it, but it's much more efficient than it was 6 or 7 years ago. Much more day surgery is done. Many more people are admitted on the day of their surgery, so they don't take up hospital beds for as long as they would. And of course, the average length of stay of patients in hospitals has come down considerably, from about 9 days. The average patient used to spend more than a week in hospital. Now it's down to around 5 or 6. And of course, the staff are working much harder. In general, are working longer hours, and in all cases are doing it for less pay. I think, though, there's only so much of that can happen before people become exhausted and before we reach our limits. And I think we've come to that point now, and the time has come now to reinvest in expanding services to meet rising demand. And that's what this government recognises needs to be done. I don't think for a second that we can solve all our problems, but we can prioritise certain things and make noticeable improvements in the quality of healthcare in the year ahead. In 2015, Minister Lynch and I plan to progress several important policies. First, always is Healthy Ireland, which is our policy and our plan to improve the nation's health. Because if we don't improve our personal health and our public health, our health service will become overwhelmed and unaffordable within a decade. What we've done is organised our work programme for the year around 5 major themes. The first is that Healthy Ireland theme, improving Ireland's health and recognising what we can do to improve our public health and well-being. The second is ensuring better outcomes for patients and strengthening patient safety. The third is modernising our health infrastructure, and that's buildings and IT. The fourth is making the first concrete steps to build a system of universal healthcare and to improve access to everyone to our health services. And the fifth is continuing the reform agenda, albeit perhaps at a slightly slower pace, and developing innovative funding models. As I mentioned, the first thing is Healthy Ireland, and there's a number of things we'll do this year to realise that. The first is the Healthy Ireland survey. It's the first survey of our public health since 2007. You'll often hear statistics quoted about obesity and other things in Ireland. The numbers are actually very out of date. So this will be the first survey of the nation's health done since 2007, and we'll then repeat it every year, and will allow us to measure the progress we're making or not making, as the case may be, as we introduce our policies. On public health, I've published the heads of the public health alcohol bill, and that involves a number of measures to try and reduce the amount we drink in Ireland down to the OECD average. We're the 5th heaviest drinkers in Europe, and Europe is the heaviest drinking continent in the world. So we're way up there, and we have a big problem with binge drinking in particular. So what that involves is minimum unit pricing, a floor price below which alcohol cannot go, and that's really designed to eliminate very cheap alcohol from the supermarkets. It's not designed to increase the cost of a pint in the pub, or we'll say a glass of wine in a restaurant. The second area is structural separation, requiring that alcohol be kept in a separate part of the shop. The exact detail that has to be worked out, but there's very good common sense reasons behind that. There'll be the labelling of alcohol, both health warnings and calorie labels, so that people know what they're consuming. And also there will be regulation of marketing and sponsorship legally for the first time. There'll be, Mr. Riley is pushing ahead with the moves on tobacco. That's particularly around plain packaging and getting rid of branded tobacco. We'll also have legislation on calorie posting, putting the amount of calories that you're consuming if you pick something on a menu right beside the price, so people can make informed choices about what they're consuming. A little story I always tell about that is the chicken Caesar salad, which for years I thought was the healthy option, and had it probably about twice a week for lunch, and it's not. It really isn't. It's terrible, and that's down to the chicken, particularly if it's fried, and the dressing. I'd be much better off to have the burger, quite frankly. And there are loads of examples of that. Very often, the healthiest thing on the menu is the 8-ounce steak, and not the vegetarian stir fry. So I think if people had better information, they could at least make better decisions. And these things do make a difference. We know from New York and other jurisdictions that it's caused about a third of people, between a quarter and a third of people, which is quite a lot, to change the way they order. Similar, I think, is true about tobacco. And I've 2 5-year-old nephews, and I was with them a few months ago, and they saw a guy walking down the street smoking a cigarette, and they asked me what he was eating. And I think that really says a lot, so we've come so far now in tobacco that huge numbers of children don't even really know what a cigarette is. And that does, every now and then we've had a bad day, remind you that policies and legislation actually do make a difference sometimes. The second theme is around patient outcomes and patient safety. We've set a particular target to reduce the number of delayed discharges. You'll know from the debates in recent weeks that these are the very large number of people who are in our hospitals who would be more appropriately back at home if the home supports were in place for them, or in a nursing home, but can't get there for either reasons of funding or other logistical reasons. And that in itself then impacts, of course, on patients on trolleys and overcrowding in emergency departments. So we're aiming to get that number down. You wouldn't think it from the media coverage, but it is coming down. It was 850 back in November, and the number of delayed discharges just went under 700 today, so it's about 698 today. So if we could push that down to 400 or 500, there'll always be a certain number of people waiting for a nursing home or waiting for their home care actually put in place, or their forms to be processed. But if we could get it down to about 400 or 500, it would make an enormous difference in our hospitals. And our aim is to do that, and to, by effect then, ensure that the number of people on trolleys over 9 hours falls to about 70 on average. But by Q4 of this year, it's close to double or triple that on occasions at the moment. We're going to struggle to meet the existing targets on waiting times, which have not been abandoned. But what is a simple fact there is that the rising demand we're not able to keep up activity to meet the demand. But we are going to particularly focus on anyone who's waiting more than 18 months between now and the summer, and anyone who's waiting more than 15 months between now and the end of the year. And we think that is doable, with the exception of a few small subspecialties where it isn't possible to recruit a consultant or something like that for a particular reason. That's not to say that we're saying it's acceptable that people wait that long, or that we're abandoning any existing targets. We'll continue to focus on the price of medicines. They've come down a lot in recent years, both for patients and for taxpayers. We're going to go at that again this year and bring them down further. We'll continue the process of moving people out of congregated settings, settings like ours attract our institutions, and moving more and more people into the community. I can't remember the exact figure, but I think about 300 people, probably not that many, but something in that ballpark, in the next year or two will move out of congregation settings into the community. Minister Lynch will also publish the review of the Mental Health Act, and we'll also do more to audit the enforcement of the National Clinical Effectiveness Guidelines. And you'll know a lot of them, the early warning scores and so on, which are no good if they're not used, and there is evidence that they're not being used as well as they should be in some of our hospitals. The third theme is universal healthcare. There's been a lot of talk about that, but we want to make the first concrete steps in that space. What we hope to have in place by the summer is GP care without fees for the oldest and youngest in society. Those are people over 70 and people under 6. At the same time, we'll continue to widen discretion for those who are the sickest in society but don't meet the income limits for a medical card. So the number of people with the medical card on a discretionary basis, these are people who don't meet the income threshold but have a lot of healthcare needs, has already gone up from about 50,000 to 75,000 this year. But I think we'll need to widen that discretion further, because even though these things are complicated, people do see the injustice, or perceive an injustice in extending healthcare without fees to children who may be well, while not providing it to children who may be very sick. In reality, actually, I believe the under 6s and over 70s proves the need for universality, because what I have learned over the last year or two, and I never understood medical cards, by the way, either as a politician or a GP. It's only now I've managed to understand them, now that I understand the legislation and the guidelines and all the oddities behind them, is that no matter where you set the threshold, there's always going to be somebody just above it. So if you have a financial threshold, there'll be somebody who's a 5 or 10 or above it. You raise the threshold, there's just as many people just above it. They just happen to be different people. And the exact same thing applies if you try to apply some sort of sickness test. There'll always be somebody who's told that they're not sick enough, or not sick enough yet, and come back when you're sicker, and we might give you the medical card. And that is what happens when you have means tests and sickness tests, and proves exactly why universality is much better and also means you don't have to put people through the whole process of means tests and sickness tests, which actually can be quite humiliating for people on some occasions. The under 6 is a lot more than people think. I know some people perceive it as just an attempt to give a sop, if you like, to middle-class parents. Often parents who are struggling, by the way, with bills for childcare and mortgages and so on, and are the ones who are paying the taxes but qualify for very little. But it's actually much more than that. It's a new GP care service for everyone under 6, including children who have medical cards already. And what's different to it from the existing service is that it will involve the management of asthma in practice by the GP, by the doctor who knows your child, rather than through hospital clinics. And also will involve a limited number of health checks during the life course to try and pick up things like childhood obesity much earlier, so they can be dealt with much earlier. And that really foresees, if you like, what we'd like to do with the contract for the entire population, which at its core must have moving chronic disease management from hospitals into primary care, where it's managed by GPs and practice nurses who actually know the patients, rather than the hospital clinic, where so often it's just the SHO that sees the patient, and that patient moves on, that doctor moves on every 6 months or so. We'll also be bringing in further measures to make health insurance more affordable. Nobody in Ireland likes the fact that we have a 2-tier health system, but when you take them beyond that, there's very little else that they agree on. But one thing that I certainly believe is that we should make health insurance universal so that everyone has it, but before you do that, you have to make it affordable. And we've introduced a number of steps in the last year or so to try and make it more affordable again. And you're starting to see the impact of that. The number of people with health insurance went up in the 3rd and 4th quarter of last year. It looks like it's going up significantly this year already, and will again before May. And you'll see some of the packages the health insurers are offering that are much more affordable than they were in the past. And we may get to the point then where we can continue to make it more affordable, and at that point make it open to everyone. And this will result in a revised roadmap to UHI, which I'd hope to have to government by the summer. The 4th theme is modernising our infrastructure. The big capital projects are really the big 5. There's the new National Forensic Mental Health Campus, which is the old Forensic Mental Hospital, or Central Mental Hospital, I think they call it, is moving from Dundrum out to a new modern campus in Portrane, and construction on that will begin early next year. As you know, Holles Street is moving to St Vincent's, and the planning permission for that will go in this year, and the other 2 maternity hospitals will also move to be co-located with adult hospitals, so that's going to take a bit longer, and the same will happen in Limerick too. The exact locations as to where the Coombe and Rotunda are moving hasn't been decided yet, but it will be decided within weeks. We're also building a new primary care centre pretty much every month somewhere in the country. But I suppose the biggest ticket item and the biggest project, and it's the biggest health project ever in the history of the state, is the new children's hospital on the campus of St James's. And the planning permission for that goes in June, all things going to plan. And on board Penola being kind to us, we'll have planning permission by November or December, and then be able to start works. Site work's already begun, but actually start construction in 2016. So after 10 or 15 years of talking about this, we can actually start building the Children's Hospital. And from my point of view, I don't think there's anything more appropriate that we could do in 2016 on what is, of course, the site of the South Dublin Union, one of the battle sites of the 1916 Rising, to build that Children's Hospital, and to recall in the proclamation the idea that we would cherish all our children equally, and I'm very keen to see that start. I have seen the designs, it's really exciting. It's a beautiful building, it has garden levels, has a cinema, even has a slide. There'll be a small football pitch, but it's also going to be a very serious place as well, of course, because it will be an international level centre of excellence, and be very closely linked in with the universities and research and academics as well, and will give access give more children access to clinical trials, which is particularly important for outcomes. The final area that we're concentrating on is the reform agenda, the establishment of the hospital groups, 6 hospital groups, and as you know, Trinity is linked in with the Dublin Midlands Hospital Group through James's and Tal and Coombe and some other sites. And the children's hospitals are coming together as a single hospital group. So the hospitals will merge before they move to the new building, which makes a lot of sense for a lot of reasons. And we'll put that legislation, at least publish it, I'd expect this year. We'll also issue the first individual health identifiers. That's a little bit like a PPS number for health. And those of you who are involved in the health service are working it will know how many different numbers patients have, MRNs and hospital numbers and you name it. And it's very hard to keep track of what's happening in the health service because we don't have an individual identifier for patients. So the first of those will be issued this year. It's going to be very straightforward for children because initially you'll be able to put the vaccines up and their GP records up. It's going to be very complicated for people who already have stacks of health records and scans and all sorts of things under different numbers. And so many people with the same names and dates of births and you name it. It's going to be very tricky, but it's high time we did it. We'll move on with the activity-based funding. There'll be a lot of legislative reform and there'll be new strategies and policies in obesity, sexual health, maternity services and the third cancer strategy as well. So that probably sounds like an awful lot in a year. My critics say it's too ambitious, or not ambitious enough rather. My officials say it's too ambitious. But I do think it is very easy to be cynical in health, and there's so many bad stories in the media all the time about what goes on in health, and they're largely true, but I don't think it necessarily reflects the totality of what goes on in our health service. And the focus tends to be on the latest complaint or the latest court case or the latest scandal, and a lot of the problems that we have seem to be intractable, they seem to be unsolvable, or seem to come back every year. But things actually do change and things do improve. Yesterday I was in Holles Street to open the new ICU for children, for neonates, and it occurred to me that 90% of the children who were in that unit yesterday would have died 20 or 30 years ago, and now 90% survive. So I think it's easy to forget about the things that have changed so much for the better. Another area is the ambulance service, and I've got involved as much as I can with them. And it wasn't that long ago when all an ambulance service really did was drive a patient to hospital. An ambulance driver came along, you got in the ambulance and you were taken to the hospital. It's not like that anymore. They're all emergency medicine technicians. Most of them now have paramedics or advanced paramedics. With the rapid response vehicles, a paramedic gets to you very quickly, can start treatment very quickly, can use up to 30 medicines, and starts treatment long before you get to the hospital. And of course we have the air ambulance now, which we didn't have before. I think other areas where we're seeing real improvements are the national clinical programmes, particularly ones like stroke and acute coronary syndrome, which have produced real results. We have now restarted recruitment once again, so the number of nurses directly employed by the HSC will increase by 500 this year, and that's separate from the increase in mental health nurses. And we've advertised about 30 different consultant posts, so we're starting to get into that recovery mode, or at least I hope we are. And I think as well we've seen in recent years a big expansion of screening. Things like breast screening, which is now being extended progressively to women up to the age of 69. Colorectal screening, bowel screening, which didn't exist a year or two ago. Screening of children for their hips and their hearing, which again is quite new, and also screening for diabetic eye disease. And none of those things were around 3 or 4 years ago, but they are there now, and there have been big improvements. And of course we've seen big improvements in cancer survival rates. We're still below the OECD average, by the way, but we've seen a particular improvement there. So I think if that tells me anything, it tells me that despite the enormous challenges and recurrent problems, good things can be done and are done all the time in health. And I think we should remind ourselves of them from time to time. So I think really to sum up, when I did become Minister of Health about 7 months ago, God, it's not 7 years, seems like it sometimes, I did know that it would be a big challenge. I knew there'd be a lot of criticism that will intensify, of course. The longer you're around and the nearer the election, the more criticism you get. But I think that's exactly why I am here, because I do want to tackle the biggest problems and try to make a difference in the areas that matter the most. When I spent my years here in Trinity, I learned a lot about civic responsibility and facing up to some of the biggest challenges in society. And so far, that's served me very well. there are a few bigger challenges than in health, and I suppose my only regret in some ways is that the election is coming so close that it will happen in about a year's time, and probably doesn't give me the kind of time that I'd like to have to achieve what I'd like to achieve in a very big job. I benefited greatly from the support of those around me, from the advice and counsel of experts in health, and also people working in some of the projects here in Trinity in particular. And I think health is important to all of us because we're all invested in the state of our health service, and we want to ensure that our families and friends and children and ourselves are protected and cared for. It's the biggest challenge that I've encountered so far. I haven't yet regretted taking it on, and it is the kind of job that people enter politics to do. To finish as I began, when I was a student here, Tom Mitchell was actually the provost, or at least when I was a fresher, and I remember that he was recognised internationally as an expert on the Roman politician and philosopher Cicero. And I think we could learn a lot of civic responsibility from Cicero. Cicero believed that the desire to make life better for others was implanted and ingrained in human nature. And I'd like to believe that's true, that there's a shared spirit to try and work together to improve the lives of all our citizens. Because working together, I know that we can address the health needs of our country and try to make this a place where all our citizens are protected, young and old. It is a shared challenge. It's an enormous challenge, but it is one that I'm up for, and I'll do my very best to pull it off. So thank you very much for having me, and look forward to your questions.
I would just like, on behalf of Trinity College and the Civic Engagement Committee, to thank the Minister for taking the time to come here this evening.
Thanks very much.
And taking all the questions from the floor, because that's not easy. I know as a lecturer myself, I like to know what questions are coming. When you don't know what questions, that can be daunting. And the one big thing I've taken from your speech this evening will be I will feel a lot less guilty eating hamburgers now than I did before.
Yeah, stay away from the chips then.
Oh yeah. So I would just ask you, please, if you could remain seated till the Minister leaves, and I would ask you finally to give him a big round of applause and thank him for coming.